All right, so as a follow-up to our previous video, I'm going to go through the current health statistics for Australia. So a lot of this data is based off the 2022 census and the AIHW report at that time. Some of these statistics have been slightly updated from a 2024 AIHW publication, but most of them will be current from 2022 onwards. So first one is life expectancy, okay? Life expectancy for males born in 2022 is 81.2 years and females is 85.3 years, okay? There are many reasons between the difference there, mostly because males are more risk-taking, they don't look after their health as more as a priority. They're very sort of curative focus, as in like a male really won't generally, this is all general talk, okay? Males really won't go to a doctor or a hospital unless it's absolutely urgent, whereas females are usually more preventative. They'll go before there's a problem or when they start to see a problem, okay? Now for Aboriginal and Torres Strait Islander peoples living in Australia, males we've got 71.9 and females 75.6, and you can see it's pretty much a 10-year difference, okay? You know, this one's only 9.5, and what's this one? 9 and 9.2, all right? So massive difference there, okay? Same country, okay? Born with the same, Medicare benefits, etc. And a lot of this has to do with health access, a lot of it has to do with breaking the cycle, but we'll talk about this more in depth later. All right, mortality, causes of death, okay? We've got our top total for all Australians, we've got the top 5 for males, and we've got the top 5 for females. So our top total for all Australians, number 1, coronary heart disease, so heart attack, okay? Trending downwards, and has been trending downwards for a very long time. Number 2 is dementia, trending upwards, okay? As people live longer and their other systems are stable, dementia is now rising as a number 1 cause of death. Third one's interesting. COVID-19, it's the first time it's actually shown up in our top statistics, okay? However, when this report gets updated, you know, in like 2025, 26 or whenever, this probably won't even be here anymore, okay? It was just that when the data was gathered between 2020 and 2022, and then they collated it and epidemiologists put it all together, COVID-19 was the 3rd highest killer of Australians in that time frame, all right? So at that point, it was trending upwards. Right now, obviously, it's probably trending downwards, but this is what the data says. Number 4, we've got cerebrovascular disease, stroke, that is, okay? So blockage to the brain, etc. Trending downwards. And number 5, we've got lung cancer. Males mostly mirror the top total except for a switcheroo at the bottom there. So we've got coronary heart disease, dementia, COVID-19, and then these two are swapped around. Lung cancer being number 4 and cerebrovascular disease being number 5. Females have a different order completely. We've got dementia as number 1. So dementia has more deaths in females than it does in males. And because, if you remember back to the previous one, females live longer on average, okay? So, and dementia is a disease of the mind, especially the longer you live, the more likely it is you're going to get it. So therefore, because more females live longer, more females get dementia. Number 2, we've got coronary heart disease. Number 3, COVID-19. Number 4, cerebrovascular disease. Number 5, lung cancer. And instead of going up or down, I've just put like a squiggly, okay? This seems to chop and change a lot in the data over the last few years. I've been teaching this for about 15 years now, or 17 years. And it was trending up for a while, and then it went down, and then it went up again, and then it went down. And then it's sort of pitted out at the moment, okay? It's not really going up or down. If anything, if you had to pick something, is it going up or down? I need to know it's life or death, okay? It's trending downwards, but not significantly, okay? And this is mainly because more and more females over the last, 40, 50 years have entered into the workforce doing white collar jobs or even blue collar jobs these days. And because of that, smoking seems to be a habit of the workplace, we should say. So more females smoke and therefore more incidence of lung cancer. All right. But there are our top causes of mortality. I'll rub this off and I'll do our First Nations people. Okay, so for our First Nations peoples, we have number 1, cancer. okay? It's mainly lung cancer, but there are other types. So you've got skin, breast, prostate, what am I missing? You know, esophageal, throat, etc. Right? Still number one cause of death. Second, we've got cardiovascular diseases. So that includes both cerebrovascular disease and coronary heart disease. Number three, injuries, all right, which didn't even appear in our, I don't think they're in top 10 for non-First Nations peoples or non-First Nations Australians. Number four, we've got diabetes. And number five, respiratory diseases, okay? Yeah, and like I said, we will talk about this data in a lot more depth as to the reasons why. So mortality by age groups, okay? You don't need to know a top five for all this, you're just in general trends, all right? So ages 1 to 14, land transport accidents, okay? So whether you are a passenger in a car or you are, you know, a pedestrian on the sidewalk, etc., or you just, you know, happen to walk out on the road and bad things happen. So number one. 15 to 24, so the age group of all of you guys, well, most of you guys watching this, suicide, unfortunately, and then road accidents are our close second. 25 to 44, my age category, suicide and accidental poisoning, which is just the fancy way of saying you took some bad drugs and you shouldn't have done that because now bad things happen. 45 to 64, now we start to see our typical ones, all right, because this is like the typical range where people in Australia die. Coronary heart disease, lung cancer. 65, 74, exactly the same. Coronary heart disease, lung cancer. Then as we start to get older, it changes. 75 to 84, we've got coronary heart disease and dementia. And then 85 and above, dementia, coronary heart disease, all right? Yeah. All right, so top 5 causes of morbidity. So remember, morbidity are the things that we are seeking medical help for and ongoing medical help, but necessarily aren't leading to death because we're getting treatment for them or we have better medication and prevention tools, etc. So number one, we've got cancers in total. So skin, breast, lung are the common ones. Prostate is a common one for males as well. Number two, we've got mental health conditions and substance abuse. Number three, musculoskeletal conditions. Okay, so just think of not only injuries, but weight-bearing issues due to being overweight and obese. Number four, we've got cardiovascular diseases, and that includes things like high blood pressure, okay? And number five, neurological conditions, so such as like early onset dementia, Alzheimer's, stuff like that, which is rising because all the other things are getting better. So there are top 5 causes of morbidity. So for First Nations people and rates of morbidity, we've got mental health and substance use disorders. So it's pretty much the same top 5 list, just in a different order. Okay, mental health and substance use disorders, injuries, cardiovascular disease, all cancers, and musculoskeletal conditions. All right, and very quickly, infant mortality, which is our fourth health statistic that we need to be aware of. It is currently sitting at 9.6 per 1,000 live births, and it is falling. It's constantly been falling for a long time, which is great. And that was my very quick wrap on our health statistics of Australians. Thanks.